Lorraine here, image enthusiast, occupational therapist. Today's message isn't about a new lipstick or skincare or even putting an outfit together. Today's message goes a lot deeper. As occupational therapists or therapists in general, we are given the opportunity to address the physical, the emotional, the spiritual, the psychosocial, and the environmental aspect of our profession. With each and every patient with whom we have the opportunity to help, we have the opportunity to address the mind-body connection. I have stressed it forever, and I will not stop stressing it because it is so very important. One does not work without the other. So the message I have today is about healing. We are always in some way addressing the healing component when we address any kind of loss, any illness, or any deficit that our patient is suffering from. As therapists, we're healers. We are working in the healthcare to help patients feel better, both physically and emotionally. We are giving and we are selfless, and we have to go in with a very open mind and a very objective view. I was very motivated, especially today, to talk to you because I just got back from church. And today, the message was specifically about healing and about strong faith. Today's gospel was the reading from St. Luke. Christ performed 2 miracles in this particular gospel. The first miracle was when Christ brought a 12-year-old girl who had died back to life. And the second miracle was a woman who was sick for many, many years with an illness who he healed. Now, the first one was the family that maybe didn't have a lot of faith that started to have faith after this miracle. And then the woman who had faith from the beginning, all she did was get close to Christ and touch the edge of his garment, and all her faith that healed her. And she was healed by this. So how does this apply to us today as individuals and as therapists? Well, first of all the words in the gospel, all the scriptures apply to all of us. We have to listen with different ears and with our heart. So we as therapists, and myself as an occupational therapist, I am always seeing patients who need help with things. We all need help at different times in our lives, but these patients are sick, they're ill, they have injuries, they have losses. And as a therapist, go in with a plan, and I've said this before, you can have a plan, go in, you need to listen to the patient. What can you offer that patient at that time you go in the room to meet with them that may be what they need at that moment? It may not be in that plan of care for the day, but you might have to hone in on something very personal. You might have to offer more support to the patient. Listen to what's going on at that very moment. That's what you sometimes have to address. That might be your session for the day. Sometimes we have to offer our patients a little more comfort, listen to them, and offer them some support in what they're going through. And sometimes I will take something as simple, I'll relate it to the self-care. I will get a nice washcloth and help them wash up a little bit, maybe change their gown. Maybe that's all they want at that moment. Maybe that's all they can handle. And sometimes I get them something to eat. They might just be wanting to have some sort of comfort. Believe it or not, the human actions and the human intervention will help the emotional and the spiritual. Sometimes it's the little steps that we take within our therapy sessions that are actually quite healing for the patients. It's not always about the big leaps and bounds in your therapy session. It is sometimes the very little things that are the big things. So as therapists, remember to prioritize what's important for your patients. You owe that to them. Just like Christ prioritized the family that needed him, they needed to have more faith in him. And the woman who had faith prioritized her to heal her. That was what was most important at that moment. With everything going on around you as an individual, put it aside. Prioritize your patient, and that's what's healing. Put your faith in God that you can do that, and put your faith in yourself and your patient. And on that note, you'll enjoy so much being a therapist. Once again, Lorraine here, occupational therapist, image enthusiast. Like I always say, mind-body connection, find your purpose, find your balance, and yes, 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 you will find your joy. Have a good day.